Good evening, everybody, and welcome to the IIMA Healthcare Alumni Special Interest Group webinar series. As many of you may know, the Alumni Special Interest Groups at IIMA are platforms that bring together alumni, faculty, and students and leverage the collective intellectual resources engaged in areas such as healthcare, education, public policy, etc., to bear on the most challenging issues of our times. Now, faculty and alumni are already making stellar contributions, but the ASIG platform allows them to collaborate with each other much more intimately and to engage with industry and practitioners in a more multifaceted manner. Now, to facilitate this interaction, we have created 14 such ASIGs and more will follow in due course. The IIMA Healthcare ASIG webinar series itself, brings the thoughts, views, and expertise of renowned experts to the IIMA community. As part of the series, earlier we've addressed industry-government collaboration, emerging digital healthcare scenario, investors' perspectives on opportunities in healthcare, Ayush, reimagining the future of healthcare. But obviously there are lots of other areas that need to be covered. Now, pre-COVID, technology was already changing things at a rapid pace, and then comes along COVID. And certainly, uncertainty abounds these days. But the speed and manner in which things have changed, and as a result, the landscape is evolving, has led to vital shifts in the way consumers behave. Wellness that sort of existed on the fringes for many people is now increasingly seen as important. There have been changes in what people consume, how they consume it, where, and how do they access healthcare services, and several other things. But fundamentally, all this has been preceded by an expansion of consumers' responsibilities towards caring for their own health and those of their loved ones. And there are many other details, obviously, and this certainly merits a deeper exploration. That's where today's session comes in. Today's topic is consumer healthcare, COVID-19 learnings, and the way forward. We have a very distinguished panel today with us to share insights and perspectives on this. We have with us Nicholas Hall, Executive Chairman and Creative Solutions Director of Nicholas Hall Group of Companies. Susan Josi, Managing Director, Havas Health and You, Southeast Asia and Middle East. And Swati Dalal, Managing Director and General Manager of Abbott Nutrition. The session will be moderated by Professor Arvind Sahay, Faculty of Marketing Area at IIMA. Welcome, everybody. We look forward to an exciting session. Now I hand over the platform to Professor Sahay to take over the proceedings.
Good evening, everyone. Welcome to the webinar. Thanks for taking the time to be here today evening. I would like to extend a very warm welcome to our three distinguished panelists. Nicholas Hall, who is the Executive Chairman of Nicholas Hall Group, a very deeply immersed in the area of consumer healthcare, especially the data globally as well as in the APAC region. We also have with us Susan Josi, who is the Managing Director of Havas, very involved in building of brands in the Southeast Asia region and India in particular, and also Swati Dalal, the Managing Director of Abbott in India of the nutrition business. I'm your moderator / host for the evening, Arvind Sahay. I teach in the marketing area here at IIM Ahmedabad. So what we will do is we'll structure the conversation for about an hour and 10 minutes or so in the following way. I'm going to set the agenda for maybe a couple of minutes, and then I'm going to ask Nicholas, Susan, and Swati in that order to share with us their views for about 5 minutes each on the issues that we would like to discuss today. And then post that, we will have a conversation. My role being to kind of direct the conversation along a path which gives us a kind of a picture, a complete picture, hopefully very difficult in an hour's conversation, but hopefully we have a better idea at the end of it than we did before. I must warn the panelists that, I am an academic, a professor, so I'm thinking about research, I'm thinking about frameworks. And so I will be kind of, with your permission, jumping in once a while here and there to ask you questions and to give my own comments and observations. Thanks to Sudarshan and Ullas, who are key drivers of this special interest group. I have been able to kind of engage at a fairly interesting and deep level with the pharma and healthcare industry in India so my observations may not be completely uninformed. So with that as the backdrop, let me hand over to you, Nicholas, please. I will give you a heads up at 5 minutes.
Thank you. Thank you, Professor Sahay. So if Victoria, who's working the slides for me, will put up the first slide. We have only 5 minutes, so please take it as read that I'm very excited to be here. I'm grateful of the opportunity to speak to you. So going straight into this, we've got 9 key learnings from this terrible year of COVID-19, the year 2020. The first thing to say is that it's not over yet. We probably have at least another year of its medical and commercial impacts. But what we do observe is that the consumer healthcare market, and I will show you some figures in a moment, consumer healthcare did very well in 2020. It seems only a small increase against the 4.6% historical, but looking at all channels of distribution, consumer healthcare purchases were up by 5% last year. At the beginning of the year, when we first heard about Wuhan, I must declare an interest here. I contracted COVID in Beijing 2 months before we even knew about it. But when we first heard about it in January 2020, we thought the market would collapse. Far from it. It's rebased, it's switched around, but it's slightly ahead of where it was. In fact, somewhat ahead of where it was. Q4 last year was very weak because of a very poor cough and cold season. In fact, globally, flu is down 25%, and it's obvious why. In most parts of the world, we're wearing masks, we're socially distancing, and that's actually stopping the spread of the more normal viruses. There's been a big trend towards immunity, disinfection, everybody knows that, but the scale of it has been impressive. We've seen a large number of new products launched, but very few of them have any innovation. I'm going to all these statements with a few slides in a moment. Very little prescription to OTC switch activity. Not that that is a big factor in the Indian market, but here's something very important. In 2020, consumers broke the umbilical cord with doctors. Now I'm generalizing, but many consumers who were consulting doctors for mild to moderate symptoms couldn't get to see a doctor, couldn't leave the house, and actually became much more self-sufficient in primary care. This is the jumpstart that the industry, which I've been a member of for over 40 years, has been waiting for, and it finally happened under very adverse circumstances, but it's happened. E-commerce, again, I'm not telling you anything you don't know, but e-commerce is racing. We call it the rise and rise of e-commerce. Forecast is pretty good for the next 5 years. This figure has a little bit been overtaken by events of the last 24 hours. We're not forecasting quite so high. And to get higher growth than that, maybe 10%, which of course is below what we're seeing in India. So please accept this as a global figure, knowing that your base is higher and therefore your growth prospects are higher. That extra growth will come from new strategies for the consumer, the pharmacist, and the doctor. Let's move on very quickly through my very few slides. This slide, by the way, this presentation will be sent to anyone who's interested in it. Contact me direct or the moderators here. What this slide says is that, the total market, which had been notching down before COVID, is now up. It was 5%, as you can see that last bar on the right. We'll take the next slide. I could spend 20 minutes talking about these, but I don't have the time. If we look just at the retail sector, and the retail sector, that's pharmacists, chemists, as you would call them, that's about 80% of total. That's not doing as well as the total market. So global sales, 3.3% in calendar 2020. If we look at India, the very bright purple, you were up by 12.8%. Really good, really, really good. I think that it's not impossible. There'll be 20% annual growth rate in a few years' time, which would be astonishing. And the next slide, please. No gold medals for saying that it's all about prevention, it's all about immunity, it's all about disinfection. These are the growth categories in 2020. Red is all prevention. Black, we have to look very hard. We only have one black. That's treatment of the top growth categories. And blue is it can go either way. It can be for prevention or treatment. But what this chart tells us is that the consumers are buying products that prevent disease. And it's taken a long time to get there. After 40 years of talking about it, we actually see it happening. And the next. Now, I mentioned that there was a lack of innovation. Since 2013, this slide is slightly out of date. As of this morning, we recounted the data. Since 2013, there have been 28,472 new launches, and less than 1% of them can be classified as innovative. 5% can be deemed important, and the rest, well, pretty basic. Next slide, please. By the way, a lot of these issues, I'm sure, will come up in the discussion.
So, Nicholas, if may I request time.
Coming to an end. Here we have the top brands, the most successful brands. Take the next slide. I just want to say one last thing, Professor Sahay, which is e-commerce, very important. E-commerce is only 3.5% of India at the moment. We think it will grow to 12. That's way behind what we're seeing in the rest of the world, where it's already over 10% and it's heading to 19%. Those are my opening remarks. Thank you for your patience, and I'm happy to hand over to Susan.
Thank you very much, Nicholas. Susan, please.
Yeah. Yeah, can everyone see my slide?
Yep, you need to go to the slideshow.
Yeah, I'm doing that. Yeah, thank you, Professor Sahay, and really my pleasure to be on this dais with such an august panelist. And thanks again to Sudarshan Jain and Ulas. So I would actually take off from where Nicholas talked about the global scenario. And, you all know that we have a very strong alliance with Nicholas for the last almost 20 years. I've been working with Nicholas on many brands and businesses. And this is actually hot from the oven, which Nicholas had shared, his team had shared with us, which is how is this working as far as the Indian OTC market is concerned. So it's one of the highest growth year that we saw for 2020, which is almost 13%, and at a CAGR of 9%. But what, of course, propelled this growth was a lot of new entrants and extensions of some of the existing brands. We had brands like Brufen, which moved into, OTC in a big way. And also Cipla Health has been very strong in some of the new launches and some of the RX to OTC shifts. So that's one big thing that we saw. And of course, two categories which kind of propelled this growth was VMS and gastrointestinals, which is very clear here. I mean, if you look at Chyawanprash or you look at vitamin C, I mean, it's a no-brainer, but these have been our immunity star brands and categories. And, you're seeing 141% growth and 161% growth. It's really outliers. But also what is important to know that the whole hygiene space is taken off in a big way. So if you see what has really impacted self-care in 5 major ways is, of course, this whole boost on hygiene solutions and immunity boosters. We in India actually are not a preventive healthcare market, but trust me, this has been the conversation everywhere. Ayurveda, natural products, a lot of home healthcare monitoring and apps are being talked about. Holistic wellness in a very big way, whether it is from a mental health point of view or from a fitness point of view. Again, how it has been, pivoted as far as the Indian households are concerned. And definitely what follows everywhere all over the world, which Nicholas also touched upon, is this whole e-pharmacy, e-consultation, e-consumption of media. So it's going to be there to stay. Predictions are there that this is not just about a year or two. I think after consumers have tasted this new way of dealing with their diseases and ailments, and just like, again, we had done some recent study on the value of OTC results are just out. We're seeing a huge amount of self-care, which is taken off at home in many ways. So what does it mean as far as the key implications of our industry? And I think I've always maintained this, that it's not just about products. It's also about a combination of products and services. And, companies who have been able to combine the two with a lot of real world based evidence, it really has made a difference for them. So people are collaborating, and that's exactly what is in the next slide. There have been some amazing collaborations which have been created between companies and the whole channel of distribution. I mean, no one is looking at, people are really re-looking at the way they're distributing their products. I mean, the whole dependence on the distribution system has got rebooted. The way they are engaging and the way they are kind of building content, and that's where actually content is becoming very, very important. And more important is how they are, building in the trust factor. In fact, very recently, the Self-Care Federation had recently launched a very nice report on the trust deficit in the consumer healthcare business, and so important for companies to build this trust. And that's also very important to know that there have been a lot of startups in this business, but at the same time, the companies who have been there for long, how do they kind of, pivot themselves to coming up with more and more innovative ways of doing it? And last but not the least, it's always going to be about science-based self-care. I mean, while we still have the natural products and while we still have Ayurveda, how are we going to bring in real-world evidence claims? And if companies stay invested in bringing these claims out, we really have a very opportunist, vibrant self-care market which is evolving in India. I'm not going to talk much about the regulations because that's always been a pain point, but I'm sure that this is also going to be important for the regulatory authorities to see the value and opportunity that exists in a country like ours.
So Susan, if I may...
I've been always talking about this, which is about, really it's all about, can we start looking at the way we get return on not just our product and services, but on the community? And the reason I say this is because we really have, cohorts of communities which are today uncatered to. I mean, we've done a lot of work in these individual communities, and we find that there are hardly any products sometimes. I mean, definitely there are products somewhere in a children's space or a women's healthcare space. And we mapped this in the OTC market data that we received from Nicholas. And we found that, it's just 25% of the market that caters to women's healthcare. And that is also because in the recent past, we've had, incidences of brands like V-Wash and some of this coming up. But there is so much of latent unlocked opportunity which can be unlocked in these categories. Similarly, in children's healthcare, I mean, there was a time that we always believed that a doctor is very, very important when it comes to children's healthcare. But we have done a lot of conversations with mothers, and I'm sure Swati will also bear this out, that when she's possibly looking at the whole nutrition space, mothers are so much more empowered today to manage some of the self-care needs of their children. A lot of untapped area is the men's healthcare business and the geriatric healthcare business. And definitely, of course, we have a growing adolescent healthcare. Their needs, there are areas of opportunities. And if we put this piece together, to me, this is actually an opportunity for a lot of companies who can win very differently in a very unconventional way than doing the more traditional, en masse products, one size fits all approach. And this is obviously what I think will become a very major part of how marketers will have to move ahead in time to come. Because I think if you can get your community right, you know what your products are, where do you have the biggest right to win, where would you play? If you put these pieces together, in future, these community-driven companies will race ahead. We have seen this globally. I'm sure in India also, more and more of these companies, if they think differently, given that the self-care landscape is opening up, I'm very sure that we can create a very vibrant consumer self-care market in our country. Over to you, Professor.
May I request Swati now to...
Thank you so much. Good evening, and it's really a pleasure to be here today. Thank you, Professor Sahay, Mr. Jain, Ulhas. Great to be here, talking to you today. I'll just start. Okay, so what I want to, focus on, and some of the themes that I'm going to talk of are pretty similar to what Nicholas and Susan have said. So I may not belabor those points, but what I want to talk is about what we see, how the consumer is behaving, what companies have done, and what can we see as the way forward. So I think, enough said. We have seen, immunity, stress, and infection, and fear of infection really has been a major trigger in the last year. And you can just see how immunity dominated 2020, in terms of the number of searches on Google. It came down towards the end of the year, and I'm sure it's going to go back to its original levels. Tremendous fear for immunity, building own immunity, and also getting infected, I think drove consumers. And you saw Chyawanprash coming up in all three talks, right? A category that was having negative 12% growth, which was stagnating, suddenly revives, and not just by the leading player, but every other player came up with Chyawanprash brand. So that's just an indicator of how the consumer actually acted, during 2020. We also saw similar trends in adult wellness drinks, which were something that were growing earlier. Enough said about vitamins, and in fact, even the IQVIA data shows a very, very healthy, 23 or 24% growth, in vitamins and minerals. And interestingly, consumers have expressed that they will continue, to buy immunity booster products in the post-COVID scenario. One of the interesting researches, has shown by Nielsen that when we looked at from a food product claim perspective, that the consumer, during this 2020 has become so much more aware, and it is claims that are relevant with, their awareness about specific nutrients, their awareness about natural ingredients, quality, the role of nutrition for themselves, their immune system is influencing their decision pattern. And also the sources of awareness have changed. So pre-COVID, we saw point of sale having a very dominant play along with TV, particularly in areas like ours, where there are multiple influencers. But that has really changed in the post-COVID scenario, and a lot of consumers have taken to digital in a manner like never before. So the role of digital influencers cannot be undermined. The role of doctors' advice being taken cannot be undermined. And in fact, point of sale, which was a very important parameter, particularly in modern trade, has fallen dramatically for us. Also, we see tremendous changes in the way consumers, access and consume their consumption behaviors. So a lot of remote healthcare access increased. The number of companies offering, consultation online has increased significantly. Although it has come down in recent times, but obviously 2021 also second half, at least a couple of months of the second half will see a different story. E-commerce, I think enough has been said about e-commerce, and like Nicholas said, the only way up for e-commerce is going up. We are much, much lower than what other countries in Pacific Asia are, and I think our e-commerce players also struggled significantly with the regulators in getting their act together, during the COVID times. Also, like we said, digital has played a major role, and we see whether it is Facebook, Instagram, YouTube, all these platforms have become platforms to consume information, to take action and take decision. And that's something I think companies need to be really aware of, and utilize as we go forward. Of course, as an industry, we saw certain categories taking off, and certain categories really tanking. And I think that's the way it's been, through this year. I'd like to sort of just spend maybe 30 seconds on what companies did. There are companies, while there may not have been that kind of innovation like what Nicholas was mentioning, I think it was quite amazing to see some companies really leverage digital. And in fact, Dabur launched 42 new products without television advertising, using only digital as the means of promoting their brands. So that's a big change as compared to what an FMCG company would do in the past. ITC is one of the other companies I think really came up with a completely slew of products in ready to eat, because they realized consumers were trapped inside their homes, and food and home cooked food was becoming more important. sanitizers and masks became the playground of FMCG and pharma together. I think Savlon is a great story. It's, J&J sold Savlon to ITC, and the way ITC has rejuvenated Savlon with every format possible for Savlon, it's just unbelievable. So it's almost like, it was a great opportunity, for a brand that one company didn't see value in, gets turned around within a year. We also saw services like, Susan also mentioned. So lots of services that came up, whether it was, healthcare at home, accessing, telemedicine, and lots of collaborations that came up, which was really geared to serve the consumer. So I think the collaborations were more to serve the consumer. So what is really then, our the way forward? I think consumers are going to be very conscious, and I'm speaking more from a nutrition lens, from a lens of, healthcare, of good health, really, because vaccination is no guarantee for, safety, and therefore, and there are enough papers to show that you need to maintain, your immunity levels post-vaccination as well. So that's something, companies need to keep in mind. Science and the logic of why your product and your brand appeals to the consumer is going to be important. Continuous innovation to help consumers stay focused on healthy habits. So can you as an organization and as a brand really bring healthy habits, in force, and not just peddle your brand in a sense? Channels will play a role. So whether it is supply chain, whether it is an organization's ability to cater to and make the switches, we have seen chemists and pharmacies rise like never before. I think we always undermined this channel, and I think everyone realizes the role of chemists and pharmacies in the COVID situation. So I think companies are beginning, even FMCG companies are beginning to realize and leverage that. So those companies who could leverage it benefited, and the others are sort of catching on to the bandwagon. And e-commerce is another space where companies need to learn how to work with the e-commerce channel partners. And I really wish e-pharmacies would do a much better job than what they're doing today, because it is still the marketplaces that are dominating e-commerce in India. And e-pharmacies still account for about hardly 10-12% of the total e-commerce market. So can e-pharmacies play a much bigger role as we go forward is something to really watch out for. And I think collaborations also, have been sort of mentioned, and there are lots of collaborations. I think whether it is technology, whether it is players coming together, whether it is helping consumers self-monitor and take better self-care, and the role of the caregiver is also going to become, far more important.
Swati, if I may request you, because that kind of gives me a segue into some questions that I was hoping to ask you guys.
I'm done.
Oh, great. Yeah. So thank you very much, Nicholas, Susan, and Swati. I think there was some really lots of interesting information over here. Let me start out by kind of stating some of the information which I was hoping that we could try and pull together. Nicholas mentioned that consumers broke the umbilical cord with the doctors and kind of started to self-dose. And he also mentioned simultaneously that since 2013, across 28,472 new launches, probably only around a few 70 or 90 or something like that have done really well. So that was one dimension which kind of struck me. The second part comes from Susan. Susan kind of shared that as we move into this new era almost for the next at least 2-3 years, because Nicholas did say that we are looking at least 1 or 2 years before things start getting back to what they were before. Hopefully, I don't know whether that will happen. Susan mentioned the fact that science-based self-care in different areas where one wants to define return on community. Now, at Ahmedabad, we kind of focus on cases to make it a little more interesting. It's closer to a story. So there were many different areas of community that Susan talked about: geriatric healthcare, children healthcare, women's healthcare. So I was hoping that we can focus on geriatric healthcare because of the changing social structure in India. there's now a whole bunch of senior citizens living by themselves, which was not the case earlier. And Swati then made this very interesting informational input, gave us this input that there was a huge number of launches, but very interestingly, the share of word of mouth has declined. So I was a little curious about that. Now, if I were to try and weave this together into one thread, the question that I would ask the panelists is, as we go forward and people are no longer asking doctors and they are kind of self-dosing, assume that for consumer healthcare, for these kind of immunity boosters, consumers continue to self-dose. Simultaneously, we are launching like a bunch of stuff. According to Swati, we launched 42, Dabur launched 42 new products, and probably 3 or 4 might be successful. The rest might fall by the wayside. Now, if I were to launch some new products and consumers are self-dosing, and you have geriatric healthcare as an issue of increasing concern, especially in India, because we do not have the infrastructure for old age care as it is existing in UK and US. So what do you see as the way forward, especially for geriatric healthcare? Because many of these guys may not be very familiar with this digital way of getting stuff. They may need help and so on. So let me start off the question with Susan, and then I will go to Nicholas and I'll come to Swati. Susan, all yours.
Yeah, I think it's a very valid question, but also what I felt, Professor Sahay, is that when we did this, report on geriatric care, what we saw actually was, actually, if you look at the people who are above 50 and 60, they're the ones who are the most curious. And while you don't see them very active, e-commerce channels may not see them, but they're really curious. They're searching, they're learning, they're trying to find more.
So let me redefine geriatric healthcare. According to WHO, now 15 to 64 is young. So I'm young technically.
Okay.
65 to 79 is middle age, and 80 to 99 is seniors. And above 99 is elderly seniors. So I was referring more to the 65 to 90 age range.
Sure. So we are inching there. I mean, a few of us, at least I'm also there inching in the next 5-6 years. But point, I think what is important is that, at the end of the day, they're also the ones who are connecting with their wards, their caregivers, maybe their people in their family. So there is conversation happening, right? They know what is happening around. They're also having time in hand. So they kind of read up on what is happening. So we always talk about digital as one way of connecting with consumers, but also let's remember that there is a huge surround sound. The WhatsApp University, and I must say this because I'm actually part of the foundation which runs elder care home in Kerala. And this was something that I started a few years back. I can't tell you that I get more data from them about what's happening with COVID and what kind of medicines that you should take and what is the right information and what's the wrong information and why should one vaccine be taken and why should the other not be taken. I think we all call it as the WhatsApp University, but they are very, very active on WhatsApp. They have a lot of time. They have a lot of knowledge. They also dissect this knowledge far more in a granular way than we people at a younger age profile will be more flippant about things. So I think that there is a whole conversation that happens between, and they're deeply involved with health. They're absorbed. They're so self-absorbed with this whole healthcare space that their knowledge is quite a lot more than what I would think from the younger age profile is. And I'm talking about the 65 plus because I've seen this actively happening as I speak. I'll get at least 5 messages from morning 5:30 in the morning till it goes on, and then it keeps building up and people will have so there is that conversations happening. Families inform them. They also want to be ahead of the curve. They want to know what's happening. And yes, they are skeptical. They're not the ones who will be very, indulgent in buying everything and anything that is thrown at them. They'll be having a lot of pros and cons.
I hear you, Swati, but when you talk about return on geriatric healthcare for the community of people, let's say 65 to 85,
Yeah.
How would you measure that? What is your metric for saying this is the return I'm getting on geriatric healthcare, return on community for that particular now, one of the figures that was shared was that the largest growth is actually for Chyawanprash.
Yes.
And that is like kind of quite a traditional thing, right?
Right.
And of course, Dabur has a fairly large share of that particular product. But while these guys are discussing these things, clearly in terms of putting their money, it is going to the older traditional, especially in India, the older traditional products, if you will. Now, how does one actually get these guys to switch, for example? If I'm Abbott, or if I am now GSK is of course part of HUL, consumer healthcare. But if I'm Abbott, or if I'm Sanofi Aventis and I have these consumer healthcare products, I would like to be able to get this particular group of people to shift. What do I do? Because in India is these customers are really cusser. They don't change easily, at least. Let me go to Nicholas on that one.
Well, I'm going to give you a slightly different perspective, and maybe this is more from a global position. And I take note of what you say, young Professor Sahay. The fact of the
I'm almost at senior citizen status. Don't go by my looks, please.
Well, then you'll be very interesting to know that we completely misunderstand the whole of the 65 plus market. And the first thing we should never use is the expression geriatric. You will turn everybody off with that old professor.
So I didn't do it. Susan did. You can put the entire blame on Susan.
No, you mentioned it when you said you were particularly interested in geriatrics. But seriously, there are three markets here. There's and let's call them senior or whatever you want. You've got those who are still at work, and they have a particular need for products to keep them on the go. Then you have the retired and active. They're very interested in energy. They're interested in all sorts of things. And then you have the truly towards the end of life's journey, the people sitting in the departure suite, and they're usually taken care of with prescription medicines. Research from Europe shows that the 60 to 74-year-olds are the biggest cohort of purchasers on e-commerce. That was a surprise. We thought it would be the young who are, in theory, more attracted to the internet. It's not true. The only category of all consumer products which has this biggest cohort amongst the older consumers is health. Susan's absolutely right. Deeply engaged with health. We influence them less by advertising than word of mouth, family and friends, but also digital is the new family. Particularly with lockdown, digital is now the way that ideas mushroom, and of course, fake news as well. The other thing to bear in mind, I didn't have time to say it in my presentation, my last comment is that the whole concept of consumer health or primary care has moved from treatment to prevention, and in the last year to protection. Consumers now want to be protected against COVID and other viruses. So that's why Chyawanprash has come back so strongly, because it's perceived as a protective product.
Interesting.
Yeah, I would, I would echo a little bit of what Nicholas said, but I think before that, I just want to outline one point, right? It comes from a basic intense fear that I am at risk, that this condition that we're seeing today puts me, before that, right, all these people who are 65 plus, a lot of them have hypertension, diabetes, other comorbidities, asthma, etc., live their lives the way they wanted without any problem. Okay? It is this pandemic that has created intense fear within them that I could fall deeply ill. Oftentimes children are living away from parents or not in the same city. So it is the influence of family, it is the influence of friends, and it is the fear that if I fall ill, I may not recover, and that is driving people to take action. Okay, it is this intense fear that is driving. That is why you see so much awareness, whether it is through the WhatsApp University or whether it is through Facebook or whatever else, that there's so much awareness on vitamin C, that everybody is consuming it, on vitamin D, on the role of iron, folic acid, on the role of, so why is that happening? On Chyawanprash, for example, which was minus 12%, right? So I think the point that Nicholas is making is very true, that I don't want to fall ill, become a burden on my family. I want to stay healthy. I want another healthy decade. And that's what's driving the action.
Interesting. Interesting. So
just add a bit to that, Professor Sahay, that, also, I think the first victim for COVID were always the elderly consumers, right? A lot of the focus was that if you're 60 plus, you're doomed, or COVID is going to take you over. And that has actually added a lot to the fear. So right from they themselves and also their kids and, not staying with them, the whole attention became to focus on protection and prevention. And that's why you're seeing this kind of change in the way this consumer is behaving,
Very interesting. You should say that. So, since I'm moderating and this is an IIMA Ahmedabad alumni special interest group, apparently, so I should make a plug for IIMA, what we are doing over here, right? Otherwise, it won't be complete. So here's the plug. We actually have a lab over here. It's a behavioral science lab, which has equipment like EEG and eye tracker and GSR, galvanic skin response, and also in the near future, we will be getting an fMRI. At least that's what my director tells me. One would love to actually see what is the extent of the different drivers of this decision making. For a somewhat younger crowd on campus, I see very wide variations on the level of fear which drives their decision making. There are some who are very clearly, there is an Indian word, Nicholas, bindas. I'm not sure what the translation might be. It's not quite uncaring, but it's I'm invincible. Nothing is going to happen to me. Something like that. Close, not quite exactly there. There are translations never completely capture it, but there are those kind of guys, and there are those other guys who are like really, really concerned. And one of them, I remember telling me that it is irrationally prudent to socially distance, and this is a young man. When you have lots of testosterone and you take lots of risk. This is a young man of 24 telling me it's the rationally prudent thing to socially distance, to wash your hands, and to wear a mask, and not to sit in the class with other people. I suspect that the same is true for somewhat older people as well. And therefore, for me, it would be really interesting to actually try and see if I could validate that hypothesis. So, this is a not so subtle plug to you guys to allow me to do some work that I can do as research for you guys. Shifting gears slightly, I want to go back to the issue of whole idea of science-based self-care, which was mentioned in the conversation. Now, science-based self-care would imply that there is a certain level of knowledge, there is a certain level of kosher information that is available to the people who are doing this self-care. Is there any evidence that is happening, or it is more based on, as you say, WhatsApp University, what I have grown up with and what my grandmother told me, and so on? So I will go with Susan first, and then again Swati, and then Nicholas. Susan, are you there?
Yeah, I think there was a bit of an internet issue. Hello?
Sorry, were you able to hear my observation question?
Just tell me once again. I think you spoke about science-based self-care.
So I was just kind of curious as to whether there's any evidence that people are looking at data, information, which is kosher, for example, a publication in Lancet that then drives some of their thinking and action rather than what they're hearing from their friends on WhatsApp groups. So how does one make that transition to science-based self-care? I mean, if one could do that, that would be really fantastic.
Yeah. So I think, Professor, here is where, it comes from the claims generation point of view, because when you say that, I mean, let's take, I quoted it even last time, that we had a statement which said that, by taking Chyawanprash, it protects you from COVID. And you had someone like a celebrity standing out there and saying, right? Question comes back is, what is the evidence? Have you done enough work around it? Is there anything that proves it? So while the celebrity says it and, someone will use it, but at the end of the day, if that same celebrity gets COVID, the entire claim goes flat, right? There is no answer to that claim. So I think is the way the TCM market grew in China, where a lot of data has also been created around these TCMs. The same rigor that is there, how do we bring that rigor into our ancient systems? And our products actually have got a lot of depth and data points with them, right, from the way they have been crafted. But when it comes to the formulations, what is the kind of investment companies are doing in it? And that is also what is now turning out to be the real world evidence claims, because we are not really looking at deep clinical, pharmacological data, because that will take a lot of time and that also takes a lot of effort. But in terms of real world evidence, and that itself is, if you look at some of the nutritional products of Abbott, or even if you look at some of the, traditional products which are coming out of some of the organizations globally, there is pretty good hard data which is being used and converted to claims. So those claims, when I say that, it really helps you to that kind of trust, that really matters. And that's what I'm alluding to when I talked about science-based self-care. And that's actually going to be an imperative as we go along, because consumers will start, like, earlier they had the doctor and the doctor infusing that trust in them. But when marketeers bring it out with strong claims and it has got strong gravitas and rationale to it, it makes a difference to the consumer. That is what I was mentioning in the science-based self-care.
Okay. Swati and then Nicholas.
Yeah, sure. So definitely, there has to be a strong logic behind your formulation, which is backed by data to show the levels that you're offering the consumer. Why are you offering the levels that you're offering, or why is your formulation the way it is? Sometimes within such a short span, when you come with new products, responding to a pandemic, you may or may not have for a formulation that data, but is like just adding vitamin C, for example, to a product is not enough. You need vitamin C of a particular level for it to have any impact on immunity. So I think consumers are becoming far more aware about nutrients, about the role of nutrients linked to immunity, what should that be, and also are reading a lot. So you're beginning to see consumers reading back of label, to understand what is in this product, and also recommendations when they're happening. It is happening on the basis of some kind of work that is done on the science of that formulation, right? It will never be clinical trials like drugs. It cannot, it is difficult, but at least some data to show the benefit of this formulation. That science will drive your brand in the longer term.
I will come back to this proposition. Actually, I will argue against it in a moment, but let me first go to Nicholas.
So I'm going to put, as is usually my role, the counterpoint of view.
You just stole my line, Nicholas.
Oh, I'm so sorry. Well, there you are. Great minds think alike. So my response when you first brought the subject was science? What science? There's hardly any science in the consumer healthcare market. And science, sadly, is somewhat debated. Look at vaccines with great companies like AstraZeneca and Pfizer. There are arguments amongst top pharmaceutical companies and against regulators on a set of facts that before you, and they can't even agree on something like, is there, are there problems, side effects from the use of these vaccines, and if so, is there a benefit? Is there still a benefit rather than risk? But coming back to consumer healthcare, the fact of the matter is that our industry has gone through a phase of profit building. And one of the casualties of that has been to take out of most P&Ls almost all R&D. There wasn't much R, but there was some D. And clinical trials, frankly, if you see one, put it in a museum, it's an endangered species. And I'll give you an example because it's often very anecdotal when we have these conversations, but I can give you a real fact. One of the top food companies that was not at that stage a player in consumer healthcare asked us to run a review of the most successful vitamins, minerals, and supplements in the market and find out how many of them had clinical trials, proprietary clinical trials with a certain scale. We found one brand. And we were very pleased we found one. And then the next week, the FDA challenged the trials, and we had none at all. So, one
of them. Go ahead. Sorry, Nicholas.
Last sentence. So, my challenge, and I say it in private sessions and I say it in public sessions to the industry, is if you believe in its future, find the 2 and 3% of revenues that can go back into some real clinical work. Either do it yourself or buy it in, but don't wait for somebody, and I'm talking here to the major multinationals, don't wait for somebody to knock on your door and say, I've got your next product, I've done the clinical trials, I've got IP, I've got it registered, just take it and sell it, because the world does not work like that.
Very interesting. Very interesting. So let me kind of build on that point. And from an Indian perspective, for example, and also I'll talk a little bit about a personal example as well. So if you look at many households in India, during the last 1 year, what they have done is they have started self-dosing on stuff like turmeric and black pepper and cloves and cardamom and pumpkin seeds and flax seeds. So these are known to be traditional remedies for many of the things. Some things kind of are antibacterial, anti-inflammatory, anticoagulant, all of which are very, very related to COVID-19 in some ways or the other. And this is very widely prevalent here in India. Some people, of course, do it more. Some people do it less. Some people get better stock of these products. Some people don't. And this is all traditional knowledge which is handed down. Now, the other part, the personal example that I have is actually my wife's formative years were in England. So she grew up there. And she still uses a lot of these old style English herbs, oregano and parsley and mint. And so over the years, I've kind of developed a taste for them. However, I used to ask her in the beginning, why are we eating this stuff? It doesn't taste natural to me. So she told me, these are some of the benefits of eating these particular things. And this is all traditional knowledge, some of which is lost in England, perhaps much more than is the case here in India. So to echo your comment, where is the science? And one could say that maybe the opportunity for firms is to take some of these things and run some studies, figure out the active ingredients, how it works, and then be able to come to the market and say, this is actually clinically tested, and therefore we think that this dose is the ideal form for you to take for prevention, for self-dosing, and not to go to your primary health caregiver. So just thought I would invite your comments on that. And since this was kind of, in a sense, a riposte to some of the earlier comments from Susan and Swati. So if I may request you to kind of share your views.
Yeah, no. And so, we absolutely believe in, having science-based nutrition, which has science of the ingredient plus clinical work done on formulations. So as an organization, we believe in that. It has nothing to do with the current pandemic, but that's the way, that's the way we work, I would say. So, I do believe that has a role to play in building credibility, trust, and longevity for your brand. If you really if you're really playing the brand game for the long run. Having said that, there are many companies and there is enough data for some of these ingredients that we talk of. Not that we have them, but for example, curcumin, 1 gram curcumin, there's enough data to show evidence in osteoarthritis, there's data to show evidence in gynecological conditions, especially related to endometriosis. And there's so 1 gram curcumin also has role to play related to antibacterial action within the body. So I think there is data, and this is data which is available in the open domain. You have to just search for it and you'll find it. Similarly, for some of the other ingredients that you mentioned. Whether the formulation that you bring to market and what we've seen in the last 1 year is companies bringing in different elements together and bringing it to market, which is very opportunistic in a sense, riding on the wave that we see of the consumer concern. And with very little time available to really do any kind of work, you're at least offering some format of immunity to the consumer in format of convenience. And I think that's the perspective I can give you from an industry lens. I firmly believe that you need to do work on your product and your formulation to build credibility.
Okay.
I would just add one thing here, and I think this is how the evolution will happen, because 100% when we started with OTCs and self-care, it had its own trajectory of brands which were, maybe they had and that's possibly one of the reasons why the RX to OTC business brands are doing far better, right? Because somewhere the trust has been built in through the doctors. They have seen the results, and somewhere that trust is played back to the consumers. And we're clearly seeing that a large part of the growth of the OTC market is coming from RX to OTC promoted brands. And very much in India, we see this happening. And I think the real, opportunity is not about doing clinical trials on every product, but what kind of evidence are we gathering? How are we postulating it? How are we kind of putting it all together? Because, in a country like ours, we would have so many, look at the plethora of brands which came touting immunity claims, from Coronil. The brand name suggested, and consumers are, they fall into that particular gullible claims which are made. And that's the reason why it hurts so badly, because I don't think we have done enough to make people believe what it is. So really, especially in a country like ours, it makes a lot of difference when, companies of stature with companies who have done work come around and talk about, the kind of depth and data that they have about their products. At least it does good for the people who are taking it. Because if today the needle is moving to self-care without them going to doctors, because they can't go to doctors, then the onus and the responsibility is on us. And that's where the responsible self-care practice needs to come into our country. And that's really what I would go all for it, to see how are we going to make this a reality, rather than allowing every small company with a garage behind setting up products which are just out there touting claims, more like home remedies and kitchen remedies, which of course, our homemakers are very adept at doing it. But I think it's very important, at least as marketers, we need to put some depth into what we are bringing out as products over there.
Amen to that. I noticed that we are just beyond 7 o'clock. So let me go ahead and invite some of the audience. If there are any questions that you would like to ask our panelists, we have such a wealth of experience and knowledge between Nicholas, Susan, and Swati. So please go ahead. Anurag, can we ask the audience, how do they come? I don't see anything on the chat.
There are questions in the Q&A section. I think it will be better if you can just pick it up from there and ask, rather than just making.
So question number 1 is, has healthcare misinformation through social media negatively impacted any consumer healthcare segments?
I think that's an open question, right? So
fairly open question. I don't know who would like to take it. By the way, I think Gopi Krishna is a doctor by profession. So,
could you repeat the question?
Has healthcare misinformation through social media negatively impacted any of these segments that we've been talking about in consumer healthcare?
Well, I'll just say that social media is both a blessing and a curse, and as well as being an amazing source of information, it's an amazing source of disinformation. And the rule of thumb is that you will disregard 100 positive comments if there's one bad comment. Doesn't matter whether it's TripAdvisor or anything else. And I think that manufacturers are scared of social media. I know a number of companies that won't even look, because if they see a bad comment, they've got to take that as an adverse event. So they don't want to do that. I would say that it's impossible to manage social media. We've learned that it manages itself, and it's the community of bloggers who are going to run things. And we can, in a sense, the best we can do is to have a good follow-up to problems that surface. In terms of misinformation about our brands, I say this is an ever-present challenge, and I think companies need to put a lot of effort into defending and correcting bad statements on the internet. In many respects, I know I'm sounding as though I'm very negative to it. I think there's a very positive side to social media, building communities, making good information, working with companies like WebMD. But I'd be interested to hear Susan's view. I know she's done a lot of work in social media.
Yeah. No, I think this is like, I mean, I completely agree to what you say. And that's why companies are investing in things like online reputation management. I mean, if you see more and more companies are trying to see how to create more social listening channels, give responses, provide data, provide information. So I completely agree that there is, of course, it hurts brands a lot. And especially because the virality is so much, if there's something negative, I mean, again, we just spoke about one of the Chyawanprash incidences which happened recently, or the Fortune oil which happened, and people spoke so much about it, and it just kind of boomerangs, into what the company has actually invested in building a credible claim for the brand. So it's all about how you manage it, but that cannot be the reason why you would not be on social media. It's all about being prepared, being proactive, having all your FAQs in place. Everything is, well taken care of. But yes, brands do suffer. And if marketers are not vigilant, it can really, really beat the deathbed for those brands.
So let me just add one little point about Nestle on that social media. So Nestle in India actually has this digital dashboard in their headquarters in Gurgaon, where they follow in real time the feeds on different social media platforms, Twitter or Facebook or Instagram, about their various brands, and they have a sentiment index that they build.
Yeah.
And if the sentiment starts to veer above a certain threshold in a certain direction, then they start creating content to counter that sentiment. Of course, assuming that the sentiment is not based on some good actual facts, and it's just kind of building up like that. If there is some underlying fact, then of course you need to deal with that fact, which is building that sentiment.
Yeah.
Let me go to the second question. Another question which is coming up is that given that, and we have talked a little bit about this, but here the question has to do with fear is a very kind of a primordial instinct, and this drives consumers towards seeking information and protective brands. Now, I would kind of add a little bit to this question and say, how does, what are your experiences over here in getting customers to come to more formal brands rather than ready-made traditional remedies? Can you share a little bit about your experiences on that side in India and abroad? So let me go with Swati and Susan first, and then Nicholas.
Sure. So I think while, in the current context, definitely fear is a trigger for consumers to think about what they're doing and therefore take some action. And that is also, in a sense, the segue for companies to be able to use or to be able to, express that fear can be allayed because of your brand, and therefore why your brand, okay? And how that your brand can really help overcome the situation that the consumer is in. So I think that's one of the key areas where, and I'll take the case, say for example, of diabetes, right? In India, because India is the diabetes capital of the world, with the pandemic coming, diabetics are the most susceptible and the most vulnerable population. And that's why we see diabetics taking every possible step, whether it is consumer healthcare piece or it was about buying insulins and stocking up on the diabetic medications, or also taking their doctor's advice, their families being extra concerned. So I think in that space, we sort of, realized that there was a need to educate the consumer around diabetes, the role of nutrition, bringing HCPs to interact with patients, educating HCPs to understand how to manage diabetes better, considering nutrition as part of the overall package as healthcare professionals, and that they're not just responsible for, prescribing medicines, and then leaving the patient open on certain other fronts. So I think as organizations, how can we realize and influence all the stakeholders? And that's what we have done in the space of diabetes, for example, working with influencers in the digital space, working with HCPs in the digital space, working with HCPs in the HCP space, and building awareness around what consumers should do who are diabetic to manage themselves better in this pandemic. So that's one example. But I think you have to look at the ecosystem and say, what can you touch? And what can you influence?
Fair point.
I think just to add again to what Swati mentioned, and this goes back to again this story of return on community, right? Because if you look at diabetes as a community, or you look at, say, oncology patients as a community, what are their surround needs? What is it that they need? It's not just about a brand, your brand, but you're addressing the entire ecosystem. And that is actually the way today you're kind of moving into that space, knowing your consumer better and providing a mix of products and services. And it could be, it's like you co-create those services. It's like sometimes when I go back, I think, how the airline industry treated you as a special citizen. It co-created a slew of so many things to make you feel special. And then you felt, I want to travel by this particular airlines, right? And that's the kind of affinity you create through your brand, because your brand is not about just standing tall and strong and saying what I do best for you. But I also think what is important is from that consumer lens, how are you going to address these special fears? What is it that this consumer is looking for? Is it at the diagnosis stage? Is it at the nutrition stage? Is it at the treatment? Is it at the follow-up? Everything then becomes a part of your mapping of that consumer journey. So within that consumer journey, how am I going to take a leadership or thought, or something ahead of what others do? And that's where the bonding with your consumer starts. So it's really exactly what we just mentioned about creating that whole ecosystem to address this, and giving the consumer the confidence with your brand, through your brand, and giving him everything that he or she would need to deal with that situation. And those are the kind of companies and brands which are winning and which are able to move ahead.
Interesting. I'll ask Nicholas to give us a final word before I put it all together as a concluding statement. So Nicholas, all yours.
So I'd like to hark back to a couple of things that have been said to answer this question. The first thing is that when things are going quite nicely, consumers feel able to reach out, they look to save money, they buy generics, they buy private labels. But when you have a crisis like COVID, consumers, even if it doesn't affect them personally, they're scared, even if they're not scarred. That's the point when they reach out and they look for trust. Now, trust could come from the doctor, but we think the umbilical cord has been cut. They can go to the pharmacist, but in some countries, I think India would be one of them, the pharmacist has a different reputation to in Western Europe. Family and friends is important, but what is so important, I think this is behind what my colleagues have said, is the brand. And I just heard this morning some new information from France, the biggest market auditor there, which is not IQVIA, it's an independent, was telling us that in this terrible crisis they've had in France, consumers have actually reached to brands, big brands for trust, or they've stayed with generic for reasons of price. But the small brand in the middle that doesn't get supported, these are the ones that have lost out. So I think if I can summarize what both my colleagues have said is put your trust in brands. It's probably not the science that's going to drive the brand forward, it's brand reputation. That's what we've got to play up every time.
Absolutely, absolutely. So if I may, with your permission, put in a little bit of the neuroscience that I work on. So it turns out that in our heads, we have this area of the brain called the VMPFC, ventromedial prefrontal cortex, and the DLPFC, the dorsolateral prefrontal cortex. And in front of a powerful, well-liked, trusted brand, the VMPFC spikes in activity, and VMPFC is a very strong center for emotion and affect. And DLPFC, the activity lowers. It's a very strong center for reason and for cognition. So in front of a good, strong, powerful brand, we actually literally trust, believe in, almost love the brand, and we deal with it at an emotional level. And ultimately, that's what we need to be able to do with the brands that we construct, whether we use whichever way we use to construct the brand. One could construct a brand with fear also. There are some interesting examples of brands constructed with fear. But if one wants the trust, then perhaps that's a much longer journey. So with that, let me...
I just wanted to outline, because you mentioned fear. I think fear has come up more in the conversation since 2020. But the point that you're making is very, very valid, that eventually people choose brands because of that emotional connect about how they feel that brand is impacting their lives, right? And that's how we build the brands. I think it's just this phase being an unusual one is where the fear factor has gone up.
Great.
And if a brand really focuses from a longer term lens and from a lens of really adding value for the consumer, you will benefit.
Absolutely, absolutely. I think Susan has dropped off because of technology reasons, but let me thank all the panelists. He's back. Nicholas Hall, Swati Dalal, Susan Josi. Thank you so very much for taking the time to be with us here on this panel for the Ahmedabad Special Interest Group on Healthcare. It was my pleasure and privilege to be a moderator today. I learned a lot today from all of you guys. And if Sudarshan will permit me, I will kind of bug you for some more information and details on things of interest to me. Sudarshan, over to you, sir.
Anurag will take over. Sorry. Anurag will take over. Over to you, Anurag.
Well, thanks, Sudarshan. So thank you all. It has been an absolute pleasure to have all of you as panelists over here. As Professor Sahay also mentioned, this is a really distinguished panel that we have had. Probably among the best that we could have had to throw more light on consumer healthcare. The things that we covered have actually been a very wide breadth of issues that have been sort of front and center of what we've been dealing with in the past. Definitely in the past 1.5 years, immunity and prevention and wellness, and the expansion in which the consumers are sort of trying to take control of what earlier used to be in the hands of the doctor, saying that if I'm not well, the doctor will take care of me. But now people are wanting to take control of more of that, and that's a lot of we sort of peeled back a lot of those layers and of emotions as well, a lot of those layers of behavior as well. And I'm sure that this distinguished panel can share a lot more on what we've talked about. This 1 hour has not done justice to what they can share with us, but it's been an absolute pleasure to hear from all of you, and thank you very much for being here with us today. Thank you all.
Thank you so much.
Thank you, guys.
Thanks a lot.
Out to you separately via emails. I'm sorry, I missed that one.
Thank you.
Thank you.
See you. Bye-bye.
Bye-bye.
Thank you. Thank you to everyone. Thank you.
Thank you very much.